I had a tooth that was bothering me, and I went to regular dentists and they pulled out the tooth, but when they pulled the tooth, they saw that it was a cyst under. They recommended for me to see an oral surgeon.
So Ryan had a large and aggressive tumor of the lower jaw that essentially was growing and needed to be taken out. And so we were able to do that, but in order to do that successfully, we had to replace the bone that we took out. So our options were limited in Ryan, and one of the kind of techniques that we use is a microvascular surgery. And that's simply where an oral maxillofacial surgeon can borrow some tissue or bone. In this case for Ryan, we borrowed it from the lower leg, and we were actually able to take this and actually use it as a transplant in Ryan and to reconstruct the jaw.
I'm a big runner. This is kind of what I do to kind of let steam off. So I was very nervous about it. All my oral surgeons during this process have been, I think, remarkable doctors. They have been both direct with me of telling me what's wrong, what can do, but not overly aggressive and saying, let's do surgery. Taking a much more conservative approach. And then, kind of using surgery as a last resort. So my recovery after surgery was pretty good. It was probably 6 months easily. I was back to running. Probably within a month, I was back to eating normal foods. So it was a pretty, I wouldn't say painless, but it was a pretty fast recovery that honestly surprised me. The doctors during the entire process were excellent.